This COVID-19 pandemic just caught them in a space where they just started to panic, and it was like they forget everything that they learned. So it was for us to go back there and say, guys, but remember, we always used to work with TB patients. We are working with MDRs every day. This is the ward where these type of patients were lying all along. And we were also not sure, how this pandemic was going to play out. So it was difficult in the beginning.
If we can get infections down in the public, less people will die. Less people will come to hospital. It depends on the public. And that's what I want to tell. Everybody talks about frontline workers, frontline people fighting the fight about COVID. We are not the fighters. We just salvage what's happening.
We came from church on Sunday, had our lunch. In the evening, I started having a headache. My husband as well, he had a headache, but mine was too strong, so I didn't enjoy the food. Now the taste was funny. And then Thursday, I could not smell now, and we knew now it's COVID.
For me, I thought it was just flu, because another symptom, it's like the body aches. Okay, I think that was a major symptom, and also that vomiting whenever I eat something. Then I would vomit.
They phoned me, they said your husband has taken a turn for the worst, and we just want permission from you to use our strongest antibiotic on him, and you're not going to be able to speak to him because we're going to intubate him, but he can hear you. So I said, do whatever you can to help him. I didn't get any report back from the doctors until around 6 in the evening, when they phoned me and they said, Miss Smiley, your husband is in his last moments. His heart is failing.
The second wave hit us very hard. It came at a time where everybody was COVID fatigued. Remember, it was the peak, and then we were at a point where we started to re-escalate the non-COVID services. We opened our theatres to full capacity. The impact on the staff at that time, it just came at a time when all of us was really, really tired. And it took a lot of us as leadership, for me as nurse leader, to get people just to go on. Most of the staff has been working here for a long period of time. So it was very hard, emotionally, psychologically on the staff at the time. But I really take my hat out to the staff members, all frontline workers, but the nursing staff in particular. Even though, the first 2 nurses died, they just kept on going on.
I think if it wasn't for him, and I think if it wasn't for me, we wouldn't have gotten through this together. And it was very important for that moral support and emotional support, and to just vent and cry and do everything that you needed to do to get through the day, actually.
There are people who came there physically fit, thinking that maybe in a week or in a week or 2 weeks time down the line, they would go home. But today, they're not there.
I was sitting with the church people here in my house. I got a call around 2 o'clock from the doctors. They said, Mrs. Smiley, your husband has recovered. And it was my birthday on the 7th. And I was so happy that he's still alive. I thank God for that. And yeah.
And for me to be alive after those 52 days, it's a miracle. And also when I look back, now I'm grateful for each and every second that I'm living. There were a lot of vaccines that were introduced, and I can tell you now, most of the population has been vaccinated for somewhere. Maybe it's polio or it's TB, but let's Let's let the scientists do what they can do best for us.
And we're not saying getting the vaccine, you're not going to have any kind of effect after that. You may have, but it will save many lives.
You can still get infected, but it seems to be very good at keeping you out of hospital. So I would not even think twice. As soon as it's available, I'll be first in line.